Good afternoon guys, Sil here. So in this week's weekly reflection of my time in hospital, I want to talk about three things. The first thing is my sleepless night. So I basically thought that I was concerned that I had put a cannula into an artery. I hadn't, but it was like quite concerning and it stayed with me and I couldn't sleep very well. So I want to talk a bit about that experience. The second thing I want to talk about, oh, hang out, Ali, don't you want to stay? The second thing I want to talk about is sitting in a morbidity and mortality meeting with the neurosurgeons. So that's a meeting where they talk about everyone who died or had a bad outcome and had morbidity. So listening in onto how they have those conversations and what they talk about was super interesting, and many medical students have the good fortune of being able to sit into those kinds of meetings. Obviously I won't share any details of cases because it's all very confidential, but I'll share the experience. And the final thing I want to talk about is the kind of camaraderie and culture on the ward and how nice it's been to be in a supportive and grateful environment. So let's get started. The first thing was my sleepless night. So here's the situation. There was a patient who had a superficial surgical site infection. So it wasn't a deep surgical site infection, it was just where the stitches were at the top. But if that infection goes deeper into the actual surgical site where she had some screws placed in her neck, then then that could be a really serious infection because then you have to take the screws out and it's really, really bad. So she had the superficial one, so she needed antibiotics, but here's the thing, she had very difficult veins, and in her previous recent admission when she had the surgery, she had a lot of trouble with the veins. There were many nurses, many doctors, even the anaesthetist had trouble putting intravenous catheters in, cannulas in. And so she was quite scarred, and so the actual consultant, the head honcho dude, like called the registrar and said, like, make sure your best cannulator puts the cannula in. Now I'm pretty good at cannulas, but I don't think I'm the best by any means. But anyway, I was the one that was volunteered to pay tribute. And so I gave it a crack. So look, I spent a lot of time with her looking for a vein. And the IVC nurse in the emergency department had just missed her cannula. So she was in a pretty grumpy mood because she was told that she'd get the best cannulator, and the nurse in the ED who puts cannulas in, like, to everyone, missed. And so I spent a lot of time with her. I spent probably like 15 to 20 minutes just looking for a vein. Both arms I used a glove filled with hot water with a light tourniquet, and like what I put is I put the tourniquet on lightly, hang the arm so the blood fills, and then put the tourniquet on real tight, get them to pump and look for any veins, and there was nothing but subcutaneous tissue. But I found one, and it was in a weird location. It was just here, okay? And it wasn't much, but there was something there, and I, told her that let's give it a crack. And I tried and I got it in, and the flashback was just a little bit brighter red than normal venous blood, and it just kind of didn't feel right. My gestalt felt off, but she was just so grateful that I got it in, so I was like, oh, all right, well, like, I'm not sure if this is really in the vein, let's just check. And I took a blood sample out, and it was pretty dark, but maybe slightly brighter than normal venous blood. But she was in her 50s, so maybe I'm just used to taking older people's blood, which might be darker or something. And then I flushed it, and it flushed fine, which is a really good sign that you're not in an artery, because in an artery, when you put the flush on, basically the high pressure will spurt blood into your into the syringe full of saline, which you're flushing the line with. Also, when you put in the cannula and you take off the actual body of the cannula from the catheter of the cannula, then blood will squirt everywhere, which didn't happen. So I knew I was in a low pressure environment, so it really wasn't the artery, but my gut feeling, my emotional self thought it could be. Then in the middle of the night, I just woke up at like midnight, and I was just super worried about it. Like, I had a dream that like it was in the artery and that everyone would come back tomorrow and get really angry at me and that I totally screwed up. because it's a pretty big deal if you like put a cannula, an IVC in an artery. And I had checked with a bunch of other people at the bedside that that was in the right spot. And they all said, you know, because it's flushing fine and it's dark blood, it's not in the artery. So it really wasn't, but I just thought it was, and it was stressing me out, and it made me, it affected my sleep. I didn't sleep for hours. Yeah, essentially I came in the morning and just reviewed her notes and it was all fine. Another way you can tell, by the way, if cannula isn't in an artery is if when they apply a line, like a saline drip or a antibiotic line, which she was getting antibiotics, the antibiotics won't just drip into the vein. The blood from the artery will squirt up the line into the bag because of the pressure in the artery. So definitely, and that did not happen. So it was definitely, you know, I hope the point is clear. These things happen. I think basically as medical students, we're often very critical of ourselves. And so I was just being hypercritical, probably more critical than I needed to be because I was concerned. But anyway, in hindsight, I think what, I actually don't know what I'm gonna do next time I'm hypercritical of myself. I think I just need to be aware that this stuff happens sometimes and really find mindful techniques to not let it affect my sleep so much. I tried all the mindful techniques that I often use, which are like box breathing, where you breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, hold for 4 seconds and repeat, and focusing on my nostrils and, you know, a bunch of different mindfulness techniques. But I guess sometimes you just have shit nights of sleep because you're emotional. Anyway, that rant is over. Next rant. Sitting in on the morbidity and mortality meeting. This was really interesting because it was nice to see, it was really interesting to see how high level neurosurgical experts, the actual consultants, talk to one another and give critical feedback respectfully to one another when things go wrong. So a morbidity and mortality meeting, you know, all departments hold them, and they're basically meetings where all the top dogs in the department talk about all the patients that things didn't go as planned and people died or got sick, and they talk about the patient case and talk about what went right and what went wrong. And you know, sometimes they're very critical of one another, and you know, they might say that's an unacceptable complication and criticize each other's styles. But I haven't seen that. There is a lot of politics in hospitals, but I haven't seen that. What I've seen is really polite, interesting discussions, and kind of the highest level of anatomical discussion. So you know, if you're doing med or whatever, you're going to do anatomy, and you learn it at such, what I'm realizing now is a basic level, because they talk anatomically in ways that is just so, they all close their eyes and talk like about the anatomy of a certain ventricle in the brain and how to kind of get a ventricular peritoneal shunt in, and they'll describe about all these different methods and all the kind of relationships. And they'll all have this constructed image that they're following in each other's mind's eyes. They have this shared picture. Super interesting to see that level, like, you know, anatomy was for a good reason if you become a surgeon. So that was really cool. And it was nice to see their feedback. What else was interesting? And then they also talk about the number of surgeries that they all did. And it's kind of interesting to see how many surgeries a neurosurgeon does in a month, which is about 20, by the way. So that's, yeah, not as many as I thought, because I always think that they're working Monday to Friday just doing surgeries all day, but actually they're not. They do about 20 to 30 surgeries in a month, and then the rest of the time they're planning or seeing patients in their rooms, or maybe not working, I don't know. We'll have to have a neurosurgeon on the channel and ask them. The final thing, and to me the most interesting thing that I wanted to talk about, is this sense of camaraderie that I had felt today, actually. It was just like a really busy day today. Actually, it was so busy, I want to tell you how many steps I did. 11,533 steps. So that's a lot of running around, that's a lot of blood cultures and blood tests and cannulas and MRI screening safety checklists where you ask people whether they have penile implants, because then they can't go into an MRI machine or whatever. And it's a busy day, but in the exhaustion of today, at the end, just with the other junior doctors on the team, I just felt this beautiful sense of camaraderie. And not only the doctors, by the way, the nursing staff too. Like, we're all in this together. We all just want patient outcomes to be great. Healthcare is incredibly chaotic and difficult to manage, and there's so many unpredictable things that come up all the time and so many jobs that come up. So The fact that anything gets done at all, and you know, sometimes it just feels like you're spending the day doing your best to not let anyone die. Like you're not even trying to help people, you're just trying to not let anyone die. And yeah, sometimes it feels a bit like that, but yeah, at the end of the day, it's amazing that healthcare works the way it does because of how chaotic it can be. And camaraderie is just such a nice type of relationship to have with someone. You know, I've had lots of friendships and I've had relationships and that sort of thing, but camaraderie I haven't had that much of. And so now being in the workforce and like grinding it out for patients to get better is super nice. And knowing that I'm working with other people and we all have good work ethic and things like that makes it super nice. All right, guys, well, on that very nice positive note, I'm gonna go, I think I'm gonna go play a game of tennis. We'll see. But I'm gonna have a rest because I'm pretty knackered, to be honest. Yeah, chuck some comments in the comments. Let's have a chat. I answer all comments. Like and subscribe if you enjoy this kind of content. And have an absolutely lovely day. See you in the next video. Bye.